Treating patients with dental anxiety is a very common portion of every dental hygienist's day. Typically, when we'll know from the minute we walk out to see the patient in the waiting room if they're anxious or not. Oftentimes you'll find somebody out there who's gripping the arms of their chair. They may be kind of fidgeting around, moving in their chair. They're just, flipping through a magazine, but they're not actually looking at anything. You can tell just by the moment you lay eyes on them. And that would be a visual assessment. You're going to meet and greet your patient. You'll know as soon as you touch their hand to give them a handshake. Their palms are going to be cold and clammy. There's a variety of different physical presentations that you'll see the minute you greet your patient. Hannah? Hi. 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 It's so good to see you. Yeah. When you get them in the chair, they're oftentimes going to tell you rather quickly how nervous they are to be here. So when your patient tells you that they're nervous or anxious being here, the best thing to do is kind of face that head on with a calm and cool demeanor. Tell them, you know what? Everybody's nervous when they come here. You're not the first one. We're used to that, and it's okay. We're going to take good care of you. We're gonna find out exactly what makes you anxious about being here and try to find a way to minimize that as best possible for you. Okay? So Hannah, I see it's been a little while since you've been into the dental office. Can you tell me about what's kept you away from visiting us? Did you just move here, or are you slightly nervous being here?
I'm a little nervous, honestly.
Okay.
Yeah.
So can you tell me what makes you nervous? Did you have a bad experience in your past, or do you just not like the smells or the sounds, or do you
More so that.
More so the smells and sounds?
Yes.
Okay. So once you're in the chair, if I can do something to help diminish the smells and the sounds, maybe offer the essential oil diffuser with a little bit of a fresh scent that'll kind of be calming and relaxing.
Yeah.
That could maybe help you. And then when we're ready to actually start treatment, if you would like to, I see you brought your earbuds, which you can put those in and listen to some music or maybe a podcast or whatever you like the best. Yeah?
Yeah, that might work.
Okay. A patient comes in and they haven't been in a long time. They may have a lot of dental decay or issues, pain, and oftentimes they're embarrassed about the presentation of their mouth the day that they come here. And finally, that level of embarrassment, they're afraid to smile. They tend to hold their hand in front of their mouth as they're talking because they don't want anybody to see what's going on in there. And when they have reached that point, that level of embarrassment finally outweighs their fear, and that's what gets them in the door. Okay, so when they get here, we have to work as best we can to figure out what makes them nervous, what makes them anxious, and then find a strategy to help to diminish those things for them. There are many different distractors that we can use in a dental office. If you ask the patient if they're nervous or anxious because of the smells in the office and they say yes, then by all means operate an essential oil diffuser, and you can put lavender or balance or one of those great fresh smelling essential oils that helps to relax a patient. That can help mask or totally cover the smells of a dental office and some of the materials we use that are just unmistakably inherent to dentistry. Okay, so before we start anything else, we're going to do a little bit of a breathing exercise. It's diaphragmatic breathing in order to kind of get your diaphragm activated in those deep breaths, and that is a very calming and relaxing type of breathing. Okay, so we're just going to do it a couple times to sort of give you an idea of how you can do it, and it's something you can do on your own at any given point in time that you're feeling a little stressed over something. Okay. So what I want you to do is I want you to lean your head back for me and just kind of relax and close your eyes, okay? So when you take your first deep breath and kind of puff your belly out like a big balloon, okay? So breathe in, puff and hold it. Now breathe a little bit more in right at your rib cage and just sort of puff that up. Now one more, little bit more breath right all the way up to the clavicles. Okay, so hold 1 second and then release from the clavicles, release from your rib cage, and now release from your belly and let your belly button touch all the way back to your backbone. Okay. If the patient tells you that it's the sounds that, and it may not even be a sound we're making in the room that your patient is being treated in, but it could be the sound of a dental drill or a small child crying from another room, and it's kind of wafting through the air into our treatment room. If that's the case, then recommend your patient bring their earbuds or some earphones and let them listen to their favorite playlist or a podcast or whatever it may be to help distract them from that noise coming in from another room. You did say that you were a little noise sensitive. I'm going to go ahead and give you your earbuds and allow you to put these in. And go ahead and get you something started playing, and I'm going to lean your chair back so we can get started, okay? Okay. If your patient had a previous bad dental experience, then now's a good time to just sit and have a real open, honest conversation with them and find out what happened and make sure that we don't do the same thing. You know, there are definitely patients who feel that their previous dentist or hygienist was too rough on them, or they didn't explain anything and the patient walked out with a very sore mouth and they don't really understood what happened. This is a great time to use behavior modification skills to do what we call tell, show, do, which first we're going to tell them what we're going to do, we're going to show them what we're going to do, and then we're actually going to do it. And we're not going to deviate from what we told them we were going to do, okay? They don't like surprises. Patients that are anxious or nervous, if you do something out of what the lineup you told them you were going to be doing, that's enough for them to perceive that as a threat and something else to be anxious about. Okay, so Hannah, I want to show you all the things that we're going to be using today to help, so you'll be a little familiar with it and hopefully make you more aware of everything to come so you don't have any surprises, okay? So, of course, obviously, you've been to the dentist before. You know we're going to be using a little mirror and a tooth counter. Once I lean you back, I'll be evaluating all your teeth, seeing how everything looks, seeing if you have any decay that we can find. When we get to the cleaning portion, what I like to use is a ultrasonic scaler. It's a little tube. I'm sorry. It's like a water cleaner, okay? There's a nice little curved tip. It's got a tiny little hole inside of here. When I activate the foot pedal, the tip of it moves really, really fast and the water will come out to keep moving metal would get hot over time, so it helps keep it cool. So it's kind of like the world's tiniest jackhammer, so to speak. See, whenever I activate the foot pedal, it makes that water come out?
Yeah.
Okay, and so because there's a lot of water, obviously I'm going to be using the suction. Okay, both of these things are going to make a little bit of a weird noise, so I want you to, just kind of be aware that that's coming so that they won't be so surprising when you hear them. And then when we get to the polishing portion of the appointment, we'll be using this little round rubber cup. And when I activate the foot pedal, it will move, spin around like that. I'll put toothpaste down in there. Again, another noisy little machine that I just wanted you to be aware of before we actually started using it, so it wouldn't make so much funny, weird noises. There are occasions when we have a patient that is so nervous that, we might have the option of using nitrous oxide, which is the little nasal cannula. They're going to breathe it in, and that's a very calming, relaxing method for some patients. And there are cases when their phobia of dental treatment is so extreme that we'll have to use some sort of pharmacologic measure, such as giving them Halcyon or Xanax prior to treatment to help really relax them, or even they may be a candidate for an IV sedation treatment, and that way they are totally sedated, they're totally out, they get their treatment done, and when they wake up, it's over. Okay, Hannah, so since we're having a little bit of trouble getting you totally relaxed enough to provide treatment for you this afternoon, we're gonna let you try some nitrous oxide, okay? So this is the nose piece that will go over your nose. It goes down here to a canister that offers a mixture of nitrous oxide and oxygen. Okay, so I just want you to relax and breathe it in and out through your nose. Try to keep your mouth closed for a few minutes. We'll give you a couple minutes to let that sort of relax you. As you start to feel it work, you will begin to feel a little bit of tingly sensation, usually in your fingers or your toes. And then as it'll kind of just spread like a warm feeling over your body, and you will just get really relaxed.